Welcome, everybody, to today's webinar, Overcoming Barriers to Oral Health, organized by the Institute of Public Health Practice, Research, Policy at the University of Iowa College of Public Health in partnership with Midwestern Public Health Training Center and the University of Iowa Prevention Research Center for Rural Health. Today's objectives are to discuss the key issues related to oral health in Iowa, and identify communities at higher risk for poor oral health and lack of access to oral health education and dental services, explore potential partnerships and strategies to improve access to oral health care. I'm Tricia Kitzman. I'm faculty here at the University of Iowa College of Public Health. I work for the Institute for Public Health Practice, Research, and Policy at the University of Iowa. A couple housekeeping. You can find the chat box and Q&A down at the bottom of your screen. We highly encourage you to send us messages, send us questions. We want to make sure we provide or answer any questions that you have while we're here today. And we have three fabulous panelists to share their expertise with us. I would like you to go ahead and introduce yourselves in the chat. Tell us who you are, where you are, and what you're doing, what your title is, and what you do for a living. While we wait for everyone to introduce themselves, I will have our panelists. Will you just introduce yourselves for the audience today? And Carole, you're the first on my sheet, so I'll go ahead and start with you.
Sounds good. I'm Carole with the Scott County Health Department.
Hello, I am Samuel Misla. I'm with Dental Lifeline Network.
Hi, I'm Jhanvi Desai. I am with the University of Iowa College of Dentistry.
Wonderful. Well, thank you all for being here today. And I know the people that are joining us are excited to learn about and pick your brains on some of the cool things you're doing out there to address oral health barriers. I'm going to kick us off with some questions today. Can you share a bit about your background, your current role, what inspired you to pursue a career in oral health? Anybody want to take that one on for the first jump in?
I can go. So hello, everyone. Again, my name is Sam Misla. I'm with Dental Lifeline Network. My title there is Manager of Volunteer Engagement and Affiliate Relations. And we operate the Iowa Donated Dental Services Program, or DDS. But we wanted to, I don't know if some of you all have heard of that, but we operate in all 50 states, and we're excited to be here as a panelist. Personally, I got into this line of work. I've always been passionate about healthcare and healthcare equity and access specifically. And so when I landed with Dental Lifeline Network, it was just sort of a perfect fit, especially because as I've grown in these last 3 years I've been there, I really have realized the importance of oral health and how it is related to overall body health. And so I'll get more into that a little bit later, but I wanted to go ahead and put my contact information out there. So I'll say it again at the end, I'm sure, but my email is smisleh, so my first initial last name, @dentallifeline.org. And my phone number is 303-407-1102. So great to be here. Thank you all.
And just so everyone knows, when we go and send, you'll get an email from us about the evaluation and how we did today. We'll make sure we include all of our panelists' contact information as well. So please know if you did not catch that while Samuel was sharing, we will make sure everyone has access to our panelists' contact information.
All right, I can go next. Is that okay?
Yeah, go for it.
All right. So I'm Jhanvi Desai. I'm a faculty dentist here at the College of Dentistry. I've been a dentist for over 14 years now. I did my basic training in India, finished with my master's in prosthodontics, and came here to pursue the certificate program in geriatrics and special needs dentistry. That is one area that has always been very close to me. So I came here, did the program, and I have stayed on as a clinical assistant professor in the Preventive and Community Dentistry department. I am lucky that I get to see students delivering comprehensive dental care to patients in our geriatrics and special needs clinic here at the College of Dentistry, as well as I get to co-direct the extramural program where our students go off-site from the College of Dentistry and provide hands-on dentistry in different community practice settings outside of the College of Dentistry. Very glad to be here. Thank you for having me here.
Wonderful. Thank you.
Great. So I started in dentistry as a orthodontic assistant in 1989 and did that while I was taking my pre and co-requisites for dental hygiene and really worked private practice up until just 8 years ago when I joined the Scott County Health Department as the I Smile Silver Coordinator. So our role, there are 3 of us in the state of Iowa. Our role began as work with seniors, people 65 and older. However, a couple of years into the pilot, we sort of grabbed all adults because we found there was a need for the entire adult population. And even though we help all adults, we still have a strong focus in seniors. I have always been a fanatic about oral health way back when I had braces in middle school and was encouraged by a family member who was a dental assistant at the time to pursue a career in dental hygiene. And I have absolutely loved every minute of it. I can say I am not burnt out on oral health. Not that it doesn't have its frustrations, especially coming into public health. It's a whole different world, but it has been a wonderful, wonderful career. And I'm happy to be here amongst the other panelists. I'm very honored.
Wonderful. I always love hearing people who love their jobs, right? Like that's always an inspiration. You know you're doing good work when someone still loves what they do and can talk with excitement about it. So yay. Thank you all. Why don't you share with us a little bit about your organization and what projects you specifically have been involved in within your organization? Carole,
Sure, I can go first.
Yeah, go for it, Sam.
Oh, sorry.
No, go for it.
Thanks. Yeah, and so I will just go ahead and talk a little bit about that. Dental Lifeline Network is a national nonprofit, as I mentioned. We are a strategic partner of the American Dental Association, and we celebrated our 50th anniversary last year. So we are nationwide. We operate in all 50 states, including Iowa. The DDS, Donated Dental Services Program, provides donated comprehensive dental treatment to our country's most vulnerable, with a focus on people living with disabilities, elderly, and medically fragile. And in addition, we do prioritize veterans in this program. So these are folks who cannot afford necessary treatment, cannot get public aid, or just are underserved. And so we operate through a volunteer network of 12,350 dentists right now, and 3,300 dental laboratories also donate across the U.S. And since our program started, the DDS program, we have surpassed $550 million in donated care, and we have served over 170,000 people. In Iowa specifically, Dental Lifeline Network's coordinator of the DDS program is Diane Wells. Some of you may know her. She is great. We're really happy to have her on board, and she screens the applicants. She works closely with the patients, also the volunteer dentists and the specialists and labs for overall coordination of the care for each patient. In Iowa, 212 dentists and 35 labs are currently volunteering. And so we would love to grow our program as much as we can in Iowa. Since 2005, which is when our Iowa-specific program began, we have served 2,000 Iowans, over 2,000 Iowans, and they have received $9,200,000 in donated treatment. So we're really proud of that, and we just want to continue to grow and continue to serve more Iowans in need. And then I think the second part of your question, the projects, that we're involved in. And so our biggest program, as mentioned, is the DDS program, Donated Dental Services. We also are one of the main partners of the American Dental Association's Give Vets a Smile program, which was just announced just recently last year, end of last year. And that is, of course, is a veteran initiative, and we're focused on veterans largely. So that's exciting to be a part of that. We also work closely with state and local organizations and agencies who do serve our target populations, the elderly, the disabled, and we try to spread the word with them to prospective patients, and vice versa. We also work with health organizations such as cancer clinics, dialysis centers, and we're looking to partner with more and more of those in the future. And then lastly, we do collaborate with the iSmile Silver coordinators. So it's great to see Carole here. Diane specifically works with them in Iowa. So thank you all.
So I can go next. I can talk a little bit about the preventive and community dentistry department from where I come from. So we are housed within the College of Dentistry here on Newton Road, and we have different missions within our department, starting from first being direct patient care. So I'm involved in patient care once a day every week, where I get to see patients who are medically fragile, older adults, adults with special healthcare needs. But generally, you'll end up finding me more often in the student clinics. I teach a comprehensive dental care for this at-risk population to our final year dental students who are pursuing the DDS program. So we provide services to this group of patients in our Delta Dental, Geriatric, and Special Needs Clinic. In addition to that, our department also runs the GMU, that is the Geriatric Mobile Unit, and through this we give comprehensive care to older adults who are in long-term care facilities in and around Iowa City. Right now, we provide care to up to 10 nursing homes around Iowa City area. In addition to that, education is one of our other missions. So we are uh, with our students right from the very first year and from one of their first non-peer patient experiences, right from the D1 year all the way through the D4 year in the DDS program. We also have some advanced standing programs like the Masters in Dental Public Health, as well as the certificate program in geriatrics and special needs dentistry. We are involved in certain service-based outreach programs. So there are iSmile programs at schools where one of my colleagues, Dr. Steve Levy, is involved. We have screening and mobile clinics at libraries, homeless shelters. Also, one of the service activities that our students do when they are on their extramural rotation is do community outreach. So they tie up with the local dentist and different community sources there to provide screening and oral health and hygiene education in community settings. And lastly, research is one of the other missions of our department. So we are involved in policy-based outcome research, kind of seeing how Medicaid is doing changes and updates with Medicaid. Uh, a hot topic right now, fluoridation. We have been uh, in fluoride and bone research studies. Again, Dr. Levy has been doing that over many, many years. So these are the few areas that our department is involved. Certain projects that are close to me. So apart from our clinics and the geriatric mobile unit, there is one project called as Mouth Care Matters. It is a program run by Dr. Howard Cowan. He is my teacher. So what is done here is they go out into the communities, kind of train the caregivers who are helping older adults and take care of them, kind of give them the tools and the education that they need. My DEO, Dr. Leo Marchini, he, along with others at the College of Public Health, came up with a dental aging tips app. Again, kind of directed at imparting oral health awareness to not only patients but their caregivers. We have had a teledentistry project with a nursing home facility here in Iowa, kind of a pilot project to see feasibility and outcomes. And currently, there is an ongoing project with for individuals who have special healthcare needs across Iowa, where we are looking to find options to improve access to dental care for those adults. So here are some of those projects.
Wonderful.
Thank you.
That's a lot. I love it. I love it. I
Well,
love it.
it's just not me alone. It takes a whole village.
Right.
Yep.
That's for sure. So I think probably a lot of people in the presentation today know a little bit about I Smile. But for those who are not familiar, our I Smile program spans across the entire state of Iowa. We have 15 I Smile coordinators that serve all 99 counties. And then in about late 2014, I believe, I Smile Silver came to be as a result of the very successful I Smile program. So the I Smile program is a program for children and pregnant moms. I Smile Silver came to be for, as I mentioned earlier, for those seniors who we knew that Medicare does not provide a dental benefit. And so it was thought that, hey, these folks could really use some extra care like our children do as well. So it's so hard to put the I Smile Silver program, and I know I Smile too, but it's so hard to put it in a basket of, well, here it is, nice and wrapped up. We do exactly the same thing all the time because we don't. It's in the 8.5 years I've been here, we've done a lot of pivoting and really working hard to try to focus on the needs and the specific needs of the 10 counties that I Smile Silver serves. So there are 3 of us coordinators. I myself just have Scott County, and then we have a coordinator in Lee County and one in Webster County as well. I often say a lot of our work looks like social work. We really do a lot of care coordination and navigation for the adults and seniors in our communities. I never realized the need of just having a friendly person on the phone to help them call their insurance company with a 3-way call, or help them understand how the benefits work, or to find an in-network provider. We have all said we could probably do care coordination 40 hours a week if we were given that time. But no, we do a lot of other things, which is really awesome. We spend a lot of time trying to integrate ourselves into medical systems. We feel like this is a very beneficial way to bring the mouth back into the body. So we work with hospitals. We have partnerships and collaborate with some emergency departments. So when they get a patient with an oral health issue, they will have them sign a consent, and that consent can be sent to us, or will be sent to us, so that we can reach out to that patient and help them actually find care for the issue that they're having. We also partner with the hospital in training nurses and patient care techs on how to prevent hospital-acquired pneumonia through oral care. That's been an ongoing project now for several years, been very successful. We also work 1 day a week in a medical clinic to see patients there where they're at. Along with that comes a lot of fax referrals then from the days that we're not there, from those providers referring patients that need a lot of help. We work with Mouth Care Matters as well. That's been a wonderful program to be involved with. I have loved every minute of that. It's an excellent program, and whenever we get the opportunity to educate in nursing homes, assisted living, we definitely take that opportunity to do that. Oh gosh, what else? there's so much. I know I'll forget all the little details. Again, there's a lot of focus on helping to integrate into the medical world. Samuel mentioned our veterans in Iowa. Here, we have a wonderful program called the Iowa Veterans Trust Fund for low-income veterans. That has been amazing. The dental benefit or allotment through that program is been amazing to transform veterans oral health as well as their overall health and mental well-being too. We've seen some really great turnaround working with veterans with that. So that puts us in direct contact with the county veteran service officers. Again, just another way to reach populations that certainly need help when it comes to oral health. So I think that's a good share of what we do.
Perfect. Well, none of you are bored, that's for sure, right? Someone shared in the chat the iSmile program is a great program for the state of Iowa, and I concur. I used to assist or oversee an iSmile program here in the state, so I know the benefits that come with iSmile. However, once the assessment is done and completed, it's hard to make referrals, or there's nowhere to make referrals, especially for those Iowans that are on Medicaid. I think that's a great lead into my next question for all of you. And Carole, I'll probably have you kick it off since we're talking iSmile. What are the most pressing challenges and concerns related to accessing dental care or oral health services? And specifically, what populations are at highest risk for poor oral health, and which populations face the greatest barriers in receiving these services?
So I can speak mostly to the adult population there, and it is so difficult as much as we want, and as much as we receive, phone calls and emails from people who are in need. That lack of Medicaid providers is no secret to all of us here, and that is very challenging. I know the rural areas struggle even more. My counterparts, it becomes very difficult in those areas. Even here in Scott County, where we have a lot of providers in general, it is very difficult to find care for those who have Medicaid, as well as traditional Medicare not having a dental benefit. Medicare Advantage plans also have some dental benefit that are great, but again, we struggle to find enough providers that are in network for those plans. I will say they've gotten a lot better in the 8 years I've been doing this on what they cover and how they cover, but we still have a few out there that there are no providers within 100 miles for these older folks. I would say, at least I had in my notes, that I really feel like one of the pressing challenges, particularly with our adults 22 to 55, we have a population that will not succumb to a dental home philosophy. They really just want emergency care when they're in pain. And that's been a challenge my 35 years in dentistry. There's always been those folks that they're just not going to do their preventive and go to a dentist regularly, which is what we always want everyone to do. The whole goal of iSmile is to get people into a dental home. But that can be very difficult with probably a good amount of the populations that we serve. It's hard to get them to change the mindset of prevention versus just going when it hurts. So I would say those are my top pressing challenges.
Wonderful, thank you.
It's so interesting. I had kind of the similar things jotted down in my responses. Like the first bit was like the workforce constraints, like you said. Like when we look at statistics, it's like in Iowa, we have one dentist for like 1,700 or 1,800 people. And this ratio is much higher than what it is in the other parts of the country. So other parts of the country, they have lesser population, lesser number of people per dentist. So we have definitely a big shortage there. And then you add the entire Medicaid component to it, like how many of these are going to be dental offices that accept Medicaid? I kind of understand from both the perspective, being a public health person, I'm like, let's more people accept Medicaid. It would be so much it will be so beneficial. People don't have to travel big distances to come and see a dentist and then get a dental home close to home where they will show up for appointments. But then there's this other conversation about the reimbursement and how challenging that is for dental practices to kind of work with. So there is that big workforce constraint that is, I think, one of the biggest pressing issues, um, like Carol was saying as well. And I understand it's hard to kind of link when you've done a screening and you need to put a referral and like, okay, you'll have to travel these many miles to see the closest dentist who's going to see you with your insurance. And transportation, that's another reason, I think another big barrier or a challenge which kind of makes it so hard for patients to kind of go in and get that routine care or just kind of go for more problem focused care. And like the third bit, which I've mentioned on here, which I've written on here, is like the oral health literacy component, like getting into the mindset of prevention versus limited problem focused dentistry. I think that initiative, that motivation needs to be there to kind of go past through all the other barriers there are to access that dental care. So I think those were my big three, kind of just going by what Carol was expanding on.
Thank
It's
you.
interesting because I have a lot of the same as well. And so I think from our perspective, the donated dental services program relies fully on volunteer dentists. And even with that, or maybe especially with that, we're seeing those same issues come up with folks in rural areas not being able to have the correct transportation needed or the right transportation necessary. We also have seen that even if a patient's able to see a general dentist, there's a lack of specialists for complex cases, and that's of course one more added barrier. We know since 2020, especially, dentists are experiencing hygienists and staff shortages as well. So we hear a lot of that from our volunteer dentists, and that is nationwide, of course. And then without these sufficient staff, dentists are busier than ever. So as I said, from our perspective, it's harder for them to be able to volunteer to take cases pro bono. And it's interesting to see also a lot of our volunteers are retiring. And so we're really trying to focus on bringing in more younger dentists as well, just because filling that care gap is going to be hard if we don't do that. And then we know that a lot of our elderly populations in long-term care or folks in long-term care facilities don't have access to dental professionals on staff. We used to operate a program that's similar to the program that Carole mentioned, we called it house calls, but it was we went directly to these long-term care facilities, nursing facilities, and treated patients there in that way, again through volunteer dentists, pro bono work. But we were unable to continue that after COVID, and so 2021 we had to terminate that program. I also wanted to mention just the fact that there is a disparity among Black, Indigenous, and people of color. We know that these communities often have lower rates of preventive dental visits, but also others as well. And this is just due to a variety of socioeconomic barriers. And so those are probably my big ones as well, but very similar, I would say.
Yeah, there seems to be a theme throughout with access to care, multiple concerns with access, but also Medicaid seems to be a huge barrier. And I've witnessed that multiple times through various clients and that as well. I want to pause for a moment and remind our audience that feel free to shoot us a message or a question in either the chat or the Q&A. I want to make sure we address any questions that you have spending time with us this afternoon. I'll move on to the next question. What strategies have been effective in reaching some of your hard to reach or most vulnerable populations to increase the awareness of oral health resources and the importance of preventative care? How have these communities been strengthened to increase this awareness to oral health resources, and what resources currently exist? And I know I just said a lot to you, so feel free to follow up with questions, but really comes down to what are some of your strategies that you've really used to reach some of these most vulnerable populations?
So I think with the I Smile programs in general, it's boots on the ground. It's trying to meet these folks where they're at, and then get them to a clinic for care. So I feel like that's very, very effective for both the I Smile and the I Smile Silver programs. A little bit more difficult for the adults to find them grouped, right? Where I Smile goes to schools and preschools and book clinics, things like that, where with the adults, it makes it a little more challenging to find them where they are, which the medical clinic has been a wonderful place. We also partner with a really awesome program that one of our health systems has for people with uncontrolled diabetes, and a food pantry connected through their foundation. That's been wonderful. So they sought out oral health, knowing that connection, and asked us to be a part of that. So that's been, wonderful to be there where they're at. I would say that just in the a little over 8 years I've been here, even advertising and marketing has been really helpful to reach people. Of course, nowadays the internet, more and more within the last, probably since COVID, really more and more I'm hearing from older adults on that end of emailing that they saw in the website and so forth. So, but I would say overall, just boots on the ground has been really helpful for us.
Absolutely. We agree from our perspective as well, boots on the ground and as many volunteers as we can, and especially in some of the rural and underserved areas, is key. I'll just speak from our perspective at the Donated Dental Services Program, as I mentioned, has been able to successfully help over 170,000 individuals receive over 550 million. That's nationwide, but and so with that, we're seeing a lot of things, coming into contact with a lot of things that are effective strategies that we'd like to see more of. Of course, bringing care directly to underserved communities with things like the I Smile program, fantastic. The school-based dental programs, providing screenings, fluoride treatments, sealants for children, things like that. Also, there are community health centers, federally qualified health centers, or FQHCs. We refer patients quite often who have completed our treatment plan, or the treatment plan brought in by our volunteer dentist, but needs ongoing care. So more of those and more education about their existence would be great. But that is a strategy that's of course helpful. Loan repayment. Educational loan repayment and incentives like that for dentists. We know that the Fulfilling Iowa's Need for Dentists, or the FIND project, is a great opportunity for Iowans. And we'd like to see more of that as well. And just encourage, again, putting a plug in for our program, encouraging dentists and agencies to refer their patients to our program. The DDS program, Donated Dental Services. We also would love to see more public awareness campaigns on the importance of, on the importance of preventive care and regular checkups. And then again, partnerships with schools and senior centers we'd love to see more of as well. And then I think the next question is also what the gaps are, or and what the current resources are. So Dental Lifeline Network, dentallifeline.org. We have an online application for individuals seeking treatment, but we also have a button there to donate and volunteer as well, volunteer as a dentist. FQHCs, as I mentioned, university schools of dentistry often provide sliding fee scales depending on the treatment needed. Of course, Medicaid, and we'd love to see more of Medicaid, as we mentioned. More dentists accepting Medicaid patients would solve a lot of issues. And then the Iowa Department of Public Health, their oral health program, we know they work on expanding access. So gaps that we've definitely seen as limited adult Medicaid coverage, as I mentioned, and that's state to state, but it depends on the state's plan, of course. The Medicare fact that there's no dental coverage under Medicare, workforce shortages, as mentioned prior, and then just the lack of oral health integration into primary care, which I believe all of us have mentioned prior, but many medical professionals don't routinely screen for oral health issues or don't tell their patients to find a dental home, so to speak. So I know that was a lot, but let me know if there's any questions. Thank you.
Oh, thanks, Sam.
Yeah, kind of going with what Samuel was talking about. So the College of Dentistry is very much involved with the FIND program, which is fulfilling Iowa's need for dentists. And what this program does is it tries to bring about connections between communities which have dentist shortage or they have a dentist retiring, and then this dental school where you have graduating dentists who are looking for job opportunities and kind of connecting those two areas. So Iowa trained dentists, if they stay within the state, they can serve a bigger Iowan population. So hoping with that, and in return, obviously our students they get some help with the debt repayment. So the FINE program has been great at trying to fill some of those workforce shortages that we have going on. Also, we here at the College of Dentistry, we are also one of the biggest Medicaid providers. So we do see large volumes of patients right from our student clinics, our resident clinics, as well as faculty clinics for patients who have Medicaid. We also provide, or try to integrate with the medical school through the Ryan White program, so that every patient through Ryan White who has been seen in the internal medicine department automatically gets a referral to us to find a dental home here. So that has been helpful in getting a dental home to some of the most at-risk populations, adult populations there. In addition to that, I was looking at the number of older adults living in long-term care facilities. And in Iowa, with about 400 nursing homes, we have about 20,000 people living in there. One of the things that, as I was talking about the geriatric mobile unit providing comprehensive dental care on site, it reduces that transportation barrier for patients to have to come in, kind of finding that other person who can accompany them, finding a ride service that would bring them to the College of Dentistry, reducing all of that planning or all of those pieces that need to fit together to make a dental visit at the College of Dentistry feasible. So I think those things are working for us here in the department and at the school. We also have a social worker embedded at our dental school, which helps kind of coordinate a few things here. Some of the biggest questions have always been about guardianship and POA-ship, navigating the system through that, especially when we have patients who are coming in with questionable capacity to consent, and helping them navigate through the system of how to figure this out so that their dental care does not get affected in them figuring out what their social status is or the living arrangement may be. As for other things within the community, the efforts that could help or increase awareness cannot thank the iSmile programs enough for doing that and having the um, providers available at the grassroots level, and something that we are trying to do as well as through those mobile clinics, at least get through screenings, place fluoride varnishes, and see what are the most pressing needs for those patients, and hopefully they can make it back to the College of Dentistry so we can provide some care to them. I think through the donated dental services, we are a part of that. And thank you so much for having that program. I can I can imagine patients who are already bogged down with the medical complexities of their health, the number of visits that they have going on with their medical providers, battling cancer, battling degenerative health conditions, and then having to worry about their dental health, the dental treatments, and the bills, and the and coordination with all of that. I'm very sure a lot of, all those patients appreciate the availability of this service, and thank you.
On that community efforts, Jody and I here in Scott County have what we call the Scott County Oral Health Network. And we invite people from not just dental people, but school nurses, medical people, insurance, MCO, the MCOs from Medicaid, medical side, as well as the dental side, and anybody that we can grab from our community to come to our network meetings. We feel that that's a great way to help the community take some involvement. And we've had some pretty good success stories, I think, especially with our school nurses. They've just been amazing to really help those kids, that we don't get to, who need help. And then I'd like to add the Iowa Mission of Mercy as a resource. I know that it's only once a year, but I've worked the exit interview portion of that event for several years now. And it is, again, for some people, that's their comfort zone. That's what they seek out every year, is the Iowa Mission of Mercy. And I could go on and on about the reasons for that, but it is a good resource, and people get good care, and it's what is sought out for dental care, as opposed to a dental home. Again, not ideal, but it is a good resource. So I thought I would mention that.
Wonderful.
So iMom was in Sioux City last year, and this year iMom is coming up in Coralville, September 19th and 20th of 2025. So it's coming a little closer here, which brings me to the question about I'm particularly interested in resources available for those in northwest part of Iowa. So I think in the northwest part of Iowa right now, I think one of the biggest FQHCs right there is in Storm Lake, and they do offer sliding fee uh, payments and things like that. But I'm not sure if there are mobile services that are available in that region. I know there are a few dental practices there which are privately owned. I'm not 100% sure if they accept Medicaid. I thought they used to take Medicaid previously in Pocahontas, Fort Dodge maybe, but I'm not too sure if they still continue to take Medicaid as of now. I know this because one of our extramural programs is based there. One of the sites, Storm Lake, the CHC at Storm Lake is one of our sites for the extramurals, where our students kind of go off-site for 5 weeks to provide dental care. And I think they are unable to take new patients, and I'm really sorry to hear that. But I know students, when they come back and we have like the exit seminar with them, they talk about that they see patients with Medicaid in there. Some of the private practices we have in, I think in Fort Dodge, Pocahontas. I'm not sure, as I said, if they take Medicaid, but students do talk about a diverse group of patients they provide care to in that area.
On the chat, it asked, as the only dental school in Iowa, what the University of Iowa Dentistry doing for outreach to counties outside of Johnson County to provide opportunities to those similar that are being provided in Johnson.
So I may not be completely informed about this, but I think the pediatric dentistry department goes out to the Muscatine County for an outreach on-site program to see children in that county. Um, and that is one thing that I know a little bit, but not the whole bit of it. It's kind of housed with the Department of Pediatric Dentistry. Um, in addition to that, I'm not sure. I know there was some conversation in between about having satellite centers with the University of Iowa College of Dentistry, but I think it's the discussion is in the higher ups yet, so not anything that I know at this point.
Sam, did you have something you wanted to jump in and I interrupted you?
Oh, of course. No problem. I just wanted to mention, we try to operate in all counties in Iowa. And so there might be disparities where we might have a dentist not available in a certain area, but I encourage everyone to check out our services, dentallifeline.org, and or just reach out to me and we can definitely try our best to get care for whatever individual in any part of Iowa.
Wonderful. Again, keep those questions coming in, everyone. That's what we're here for. How can public health agencies or other agencies across the state play a greater role in promoting oral health awareness? Which local or state organizations should public health professionals collaborate with or be reaching out to see how they can work together? As we all know, public health tends to be the connector. We might not do everything, but we like to be a part of connecting the community and addressing the needs within our communities. So again, kind of who should public health be reaching out to? Who are some of our good partners? If they are struggling to find them, who would you recommend?
I think greater amount of medical and dental integration, that would probably be one of the first sites where getting at screening, like getting the screening or having that question in, like how we have in like the child wellness checks, like does your child have a dental home? Similarly for adults, it would be good to have that come from your primary care or have a screening on site possible. I know a lot of the FQHCs across Iowa are kind of going towards that integration, but that's kind of more of an electronic health record based integration. There are a few FQHCs where we do have some amount of screening opportunities available for the provider at the medical or the annual physical. So I think that would be a great start. One of the biggest things I feel is more awareness about diet. Because I think nutrition is one thing we talk about from all perspectives except oral health sometimes, kind of bringing that connection between sugar and cavities and how closely they are linked, because a lot of the fast food culture has a lot of sugar embedded in them. It's just sneaky. It makes its way into our diet knowingly, unknowingly. So maybe a little more awareness about that. And with the ongoing debate about fluoridation, kind of strengthening that connection and talking about like the right concentrations of fluoride is going to be beneficial and reducing the doubt that is being sown. I think those would be great efforts to kind of bring the community to better oral health. So, yeah.
Something that our agency does, and I mean, in general, a lot of our my coworkers interactions with other agencies with their programs are really great about making connections with oral health. They've had education from Jody and I on oral health and its connection to systemic health, and they see it when they're out there doing their thing. So we have a maternal health nurse who is planted in a variety of areas, and she knows about oral health. She's been trained by Jody for screenings, and they know what kind of questions to ask and are great about sharing that information out. I think that's been a wonderful way to bring oral health awareness in our area, as well as good communication with boards of health, board of supervisors, trying to include something about oral health in all of those areas, the reports or the presentations and things that we've been invited to do, as our director is willing to, help us to share that information with our folks. And then we also have our I-Smell coordinator, within our immunization clinic. So kids that come in for their immunizations, I think that's a wonderful connection as well, some of that medical dental integration, but it's something we're doing here in public health. That's easy. They're right here. We're meeting them where they're at. So
Yeah, I just think basically all of the above. The one thing I wanted to mention, yeah, is definitely what's already been discussed as far as integrating oral health into overall health initiatives, and then public health agencies working together to talk about the other resources available beyond their own resources. And then lastly here, I just had strengthening oral health policies and expanding coverage. Of course, I think would be great. And of course, it's easier said than done, but just with an eye towards that, I think we could see a lot of really positive change.
Yeah, I kind of heard from all of you. Advocacy is going to be a huge piece, right? Using those advocates, whether it's through the Board of Health, Board of Supervisors, a combo of that, providing some additional education to get rid of the myths or maybe the dis and misinformation about fluoridation in water. So people are fully educated with the pros of how this has helped and what it looked like prior to fluoridation in waters, especially in, I think, some of the rural areas. There's more concerns for folks that just haven't seen or understand maybe what some of those numbers should look like, why we do it, those sorts of things. So I think advocacy obviously is a huge piece for all of that, not only for the education piece, but to drive some of those policy changes, whether it's Medicaid, ensuring that there's more access for those folks who are covered through Medicaid, how to work with physicians, if there's policy incentives that they could work with local dentists to improve access to care. And then obviously just the mere numbers, right? Like just finding those incentives. We have a healthcare shortage, and I think a lot of folks think of, primary care doctors, OBGYNs, because that's what's hitting the news a lot. But clearly we have a deficit of dentists as well. So definitely I think advocacy is a huge piece of that. And then connecting those partners and some of those untraditional partners, right? Like transportation, getting folks out to being able to get to where they need to be. And then I know a lot of the public health agencies that have the iSmile program definitely love to partner with their immunization clinics, their WIC clinics, their maternal child health clinics. Anytime you can get kind of that one-stop shop, makes it easier on the clients because you're meeting them where they're at and you're saving them another trip and possible day off of work, et cetera, for a population that probably doesn't have a whole lot of paid time off to go seek preventative care. Thank you. Thanks for sharing all of your expertise. We're wrapping up with our kind of last 5 minutes. For organizations or individuals that are looking to get involved with oral health activities, what are some of the key steps that you would recommend them doing that they can kind of put in their toolbox or tool belt before they leave today?
I think if they're in Iowa, contact their iSmile coordinator. We'd be happy to partner with anyone interested in oral health. That's definitely something we'd love to do.
And I would say even those that aren't in Iowa to get ideas on how the program is even how it's working, how kind of Iowa started it. So even for those folks who are not maybe in Iowa, feel free to reach out. We can connect you with iSmile coordinators across the state so you can hear how they've plugged into communities and what they're doing here in Iowa.
And I think with the resources and just obviously with our FQHCs being, really overwhelmed, our college, amazing place that it is, but they can only handle so much. Resources are difficult. There's no magic pill for this, and it's very time consuming, and it does get very frustrating when we're trying to help folks. But then I know we try to look at those that we have been able to help. Not only do we collect the data on those that we couldn't, but we are looking at lots and lots of people who I don't know where they would have gotten help if they hadn't connected with Donated Dental or, I Smile Silver in the college. That helps me not to get so bogged down in the fact that the resources are few, and it's not just dentistry, it's everywhere. Resources are not as plentiful as we would love them to be, but I think the work that everyone is doing, and I'm sure everyone that attended today, they're all doing really hard work to help people, and it's what we have to focus on. Stay sane anyway.
Absolutely. I agree. And I just wanted to say, Dental Lifeline Network, Donated Dental Services Program is a great way to get involved. Whether you're a dentist or a dentist, ask them if they're involved. Ask them if they would like to donate to see someone in need. Donate their services to see someone in need, or you can financially contribute if you are not a dentist. Spread the word, of course, if you're not a dentist, about our program. And then beyond us, we just, I think school and community groups, educational groups are important. Mobile clinics, public health clinics are also important. And then just we are looking to partner with some of these other physical health organizations, such as cancer centers, dialysis centers, to spread the word to their patients of that we are a resource. So that could go for any other resource in Iowa as well.
Volunteer for iMom. There's
That's what I was
always
going to
a
say.
need.
Volunteer for
iMom.
Absolutely.
Except you don't have to be a dentist,
Dentist to do that,
a licensed professional. You can come and volunteer, and there's plenty of need, and it is amazing. So that's a great way to be involved in oral health activities. It's wonderful.
Yeah. No, and if you're looking to volunteer, there is a free medical clinic with an embedded dental clinic here in Iowa City. They are always looking out for volunteers. There's His Hands in Cedar Rapids. Again, they're looking out for volunteers. And like Carole was saying, iMom, you can provide translation services, triage services. You don't need to be a dentist, dental assistant, or a hygienist to volunteer for that. And yeah, I appreciate everybody who has joined in, because I think this is a topic which needs to be talked about enough so that we can advocate for those who cannot talk about themselves or sometimes cannot even articulate their dental needs. So we need to be that voice to talk about them, to talk for them in a way that they can receive the care that they need.
Well, that is our time. Thank you guys for participating. Again, thank you to the panelists. Thank you for our audience. This is being recorded, and we will be sharing. You will see in the chat box, there is an evaluation link, but we will also be emailing out the evaluation link. We'll be emailing out a link to this recording so you can share it with your colleagues or other folks. Please be on the lookout for any future webinars. We will be posting these on our website and send notifications. Our next webinar will be on May 13th, and we'll be talking about expanding access to care through community health workers. So again, thank you all. Thank for participating today. Thank you to our audience. Everyone take care. Have a wonderful day. Enjoy the nice weather we're having out there, and happy spring break for those of you that have that coming up here in the next week or two. Take care, and again, thank you.
Thank you.
Thank you all.